Hello, everyone. My name is Jasmine Kaur, and I'm an executive producer and senior anchor at the National Library of Patient Rights and Advocacy. And today I'm thrilled to have us join Mr. Harjit Singh Sodhi. He has been working in healthcare from the past 40 years, and currently in the US, has been working from the past 17 years as a pharmacist. And it's a privilege to have him join us today. So thank you so much for being here, Mr. Harjeet.
My pleasure to be here.
Thank you so much. I just wanted to know, just like all the viewers, what does a pharmacist do, and what are the daily responsibilities that you have as a pharmacist?
Mostly people think that pharmacist counts tablets and capsules. Apparently, that's what it looks. But in last few years, once or twice, pharmacist has been ranked #1 trusted profession in the United States. Second and third position many times. So it's the most approachable healthcare professional to the general public. People come to us, they ask all type of health-related questions, and we try our best to answer their questions based on our knowledge.
Yes, absolutely. And there are a lot of misconceptions about, the work that a pharmacist does. And what we are really interested in knowing is when somebody comes to the pharmacy, what are the things, do's and don'ts that you have to consider and you have to educate the patient about when they visit you for a consultation or for a refill or just about any conversation or education for that matter.
The most important thing is that we should be patient enough to listen and understand the patient, that what is the need today, what patient needs today, what health condition patient wants to talk about, what kind of medication patient is expecting. That's the most important thing. And we try our best to listen to the patient and appropriately make right approach. If we can handle it, we do our best. If something needs to be, we need to send him to a clinician. Urgent cares are available all over. And most of the insurances these days have online approach to the nurse line, where patient can call the nurse line. They can triage based on their requirement, the further care of the patient.
Yeah, I hear you. When we talk about going to a pharmacy, sometimes people are in a hurry. Sometimes you are in a hurry with all the responsibilities that you have. So, how do you assure that a proper conversation is happening and an appropriate use of the time is being conducted under your guidance and under your supervision?
Uh, we are lucky enough to have certain area assigned in the pharmacy, which is patient consultation area. And we get certified technicians who help us tremendously on the general things, receiving the prescriptions from the patient, processing the prescription, filling the prescription. We basically look at the final product, that the right medication goes to the right patient, plus the clinical aspect of it. There is no problem with the patient's other health conditions. Patient may be taking some other medications, no interactions of the medications with the health condition and the other medications patient is taking.
Right.
Talking about time, that is these days, everybody is in a hurry.
Right.
We try our best to listen to the patient, and rather than we listen to them first, and based on their requirement, we try to answer their questions. Then at the end, I always tell the customer, if there is anything, feel free to call us. So that way, if there is anything in patient's mind that did not pop up at that time, that can be discussed later and appropriately handled.
Absolutely. A lot of times we use Google or some of our own friends or somebody in the family who also takes that medication, and we take their advice. And if not them, then we call our urgent care, we call our doctors. But from what I hear and what in my experience as well, pharmacists are such a reliable source for these information as well. So please reach out to your pharmacy. And I just want to know from your experience, Mr. Sodhi, how does that go? Have you just received any distress calls in your experience? And how do you handle that situation with people panicking at their home after missing a dose or after, taking multiple doses by mistake? So how do you approach that in your experience?
Thank you for asking that question. That's a very good question. And we come across those questions a lot, especially children under certain age for certain health conditions, especially if a kid has pink eye, which is an infection. There is nothing available over the counter. And we convince the patient that I am not a doctor, I'm not a medical doctor, though nowadays pharmacists are PharmD, which is doctor in pharmacy. We are not supposed to diagnose, but we are supposed to answer the questions related to the medications. So when we look at the patient and seems like on the symptoms, if it looks like pink eye, we always encourage them to go see a doctor who can decide what the problem is so it can be treated properly. Secondly, we encourage them not to use any over-the-counter stuff which can make their condition worse, especially for the little kids or elderly people, geriatric population. Certain medications are given very cautiously. So when people come and Google something and question on those things, we try to explain them that Google does not know your other health conditions or the other medications you are taking. So do not trust for it's, I'm not saying that don't go to Google. Yes, definitely. Look for the information purposes only, not for the decision making. Let the proper clinician make the decision and follow the strict guidelines, because it's in the medication when you're taking, it has to be taken in the right dose and at the right time, which is the most important. And of course, the duration of the medication, how long it should be taken. So those things are very important. People are becoming more and more aware about those things, which is good thing. But still, we come across some people who are innocent, or some people occasionally I come across who are adamant, and they get upset over the phone as well, which we try our best to give them, listen to them first, and give them proper answer with examples to make sure they understand. But sometimes we do come across someone who don't want to listen to us, where I don't know what more we can do, but we try to stay cool in those situations.
Yes, absolutely. And I do understand the frustration. Even our organization, we are a source of trusted and reliable information for anyone and everybody out there. But I want to really highlight what you brought out, that use Google and internet for information related purposes and not decision making. And I think it's imperative that we highlight that. And talking about internet, how has technology evolved over the years in your in healthcare in general and in your day-to-day tasks, does it really help sorting out the medications, and how does AI and technology helps in patient care while working in a pharmacy?
Definitely. Similarly, as in other fields, in healthcare profession, especially in the field of pharmacy, uh, the computer technology, especially the database, what we have right now, where we can see, especially on the drug misuse, for example, narcotics and those type of medications, we have a national database where we can see who is using what. And so that has tremendously helped us to bring down the overdose related fatalities and a lot of other related issues. The technology, we are using robotic counting with the newer system, with the new barcode. It reads even lot number and expiration date of the product as well, which there is a recall on certain medication. It makes sure that it's with our best efforts. Sometimes human errors are there. Like if we are doing multiple things at the same time, if we miss fill a prescription, where our target is that zero error on the misfill. So we want to make sure patient gets the right medication, which is the right dose, right strength, and it's of course not expired. And this technology has helped us a lot. Actually, we are working with technology and going forward. AI and this technology is helping us big time. So this is a really, really advancement in the field of healthcare with other fields, and of course for pharmacy as well.
Yeah, I hear you. And I see that the underlying statement, which is coming up again and again, is that patient health is the cornerstone, and that is the most, like, the utmost importance in healthcare and pharmacy as well. Are there any programs or anything else that you want to educate the viewers watching you currently, in which, patient care and their well-being is being the front stone and center of everything?
Again, a good question. Number one, do not do self-medication. That is really not a good for you, not a good thing for your health. Taking someone's medication in the family, someone had similar problem, it's a big no-no. Don't ever do it. Always go to a nearby pharmacy, urgent care, ER, wherever it needs to be. Your health is the most important thing. Good health is a big blessing, but it is kind of, we can say, human machine here and there. It needs a little repair, and it should be done by the right person. Never ever try to self-medicate, to overdose, to go to the quacks and those type of things. Very important thing is the medication. First of all, the most important thing is to get the diagnosis of your problem. When right diagnosis is made, there is always solution to that. Then the right medication can be prescribed, and make sure you take the right way, the time and duration, all those type of things. You need to focus if this medication has to be taken on empty stomach, or when you are taking, let us say, insulin and similar products. The technique is very important. And we take time to even sit down with the patient. And the newer program, which is called MTM, where we sit down with the patient and talk about all the medications they are taking. Sometimes there are certain prescriptions prescribed by the general practitioner, PCP. Something is prescribed by the cardiologist. Something is prescribed by the endocrinologist. So we sit down with the patient and talk about there is no duplication of therapy, because duplication of therapy can be very dangerous. And side effect, if anybody experiences any side effect, should be immediately reported to the pharmacist, to the doctor, or if need be, go to ER or urgent care, depending upon the health, even call 911 if it is a real urgent situation.
Yes. What that brings out for me is that go to your pharmacy and visit your pharmacist and be patient. Spend time with them, ask for a consultation. Your health should be the most important thing for you. And taking time to talk to your pharmacist and have a list of questions ready for them is I think recommended from what I'm seeing Mr. Sodhi suggest right here. And yeah, have try to have a healthy and happy relationship with the pharmacy that you visit, because they can save your life and they will save your life. And any final words of advice for anybody who's watching, Mr. Sodhi? Anything that you want them to definitely take out from this interview and remember forever, for their lifetime?
It is the responsibility of the pharmacist as well to have healthy relations with the patients. Honestly, we consider patients as part of our family. We make sure that we put ourselves in someone else's shoes when we are treating the patient. For us, we have to make sure we are given the right medication. Trust your eyes, don't trust the bin. And make sure when we are answering the questions to a patient, we listen to the patient and satisfy up to their extent what they want to know. We should try our best. And as a patient, my advice will be, if you are not satisfied with one person's advice, there is always option to take second opinion. If one is not satisfied, don't take your health condition lightly. No need to panic. But at the same time, don't take health lightly, because health is the biggest wealth you have. If you have health, then you have everything. Thank you.
Yes, those are wonderful words to end this interview with. Thank you so much, Mr. Sodhi, for your time. And we will all see you in the next interview. Thank you so much for tuning in today.
Thank you. Honor and pleasure for me.